As part of our Navratri series, we have Dr. Harapriya, renowned pediatric cardiologist, with us. It's such a rarity to find super specialty doctors who are specializing on kids, and that too cardiology. So, I have a lot to ask her and learn from her in this episode. So let's hop on to it. Thanks, doctor. Thanks for coming in today, taking your time off.
It's my real pleasure, Vanipriya. Thank you very much for inviting
Thanks
me.
a lot. So, எல்லாத்துக்குமே there's an origin story இல்லையா? So I want to understand how you got into choosing the specialization, right? It's not often that I hear about this. So how did you get into this journey itself?
I chose to become a pediatrician first, because I definitely like to treat children.
How did you decide to become a doctor first?
That was not any big decision. I think it was, in those days, it was just you study for some entrances, whichever you crack, you will land up there.
And
it was
it's
like
not
that.
an easy one to crack either.
Fortunately, unfortunately, I was the first doctor in my family, so I didn't come from a family of doctors. And of course, medical school teaches you a lot of things. You're not sure what you want to do at the end of it. And of course, some specialities do teach you that you want to take it up. I didn't want to become a surgeon because I'm a very clumsy person. I have butterfingers. So, but then I always thought knowledge, the strength of knowledge was my good side. So I thought I'll delve into a specialty which involves a lot of knowledge, like a medical specialty. And one of that is pediatrics. So, and after finishing pediatrics, in those days, it was not important to specialize into the different aspects of pediatrics. So all you had to do was treat children head to toe, all aspects of them, which will predominantly involve, the care of well children, giving them vaccines or treating their coughs and colds. But then that involved a lot of, your evening practice, and you need to spend time in the evenings when you have to run a clinic and all that. When I was looking for a hospital-based job, and so this opportunity just opened up, and I joined the specialty of pediatric cardiology, and over the years, I've gained immense experience in that.
Right. And were you practicing pediatrics before you got into this specialty, or you just continued studying?
That is immediately after finishing my general pediatrics. I was working in general pediatrics for a while before I switched into pediatric cardiology. So it's been like nearly 18 years, I should say, since I switched into pediatric cardiology.
I'm sure there's a difference in the way you treat or look at patients between the two specializations, right? One is more intense and more life-threatening kind of cases that you met. So what was that mindset shift that you had to make between the two specializations?
Yeah, actually, when you asked me, when I first joined the specialty, I also had very small children who were like little infants. So each time a sick child comes to me, I always couldn't help but thinking, what's it like if it was my child?
Right.
How would I react? So that feeling always stays with you, and whenever you treat the child, you always wish them well. That's what I tell every parent also. In every treatment, however intense, however complex, whatever uncertain outcomes we may still give, we are together in that journey.
Right.
We will together work towards this child's well-being. So that was one main thing. It is not like you are the parent and I'm the treating physician, and then we are not on opposite sides on this.
Absolutely.
So when we together take the journey, it becomes easier for all of us, for both of us, whether to go through the intense phase, to go through complications, even sometimes untoward events like a death. So when we are together in this journey, it kind of, like some of these children, when they recover and then they grow up, there are some children who have now, on these 18 years, they've finished schooling, they've joined college, they're very happy to come and show me their +2 marks, or they've joined colleges. Some have joined nursing. Many of them say they want to take up something in the medical field or the other. So somehow we do inadvertently make an impact in these children's family. Even the family wants them, why don't you take up something in medicine? Even though I advise for most of these complex children not to take up medicine, but still, like whether we like it or not, somehow we make some kind of impact in those families, I'm sure.
Absolutely. Right. When you're talking about families, right, I think one of our discussions earlier, you spoke about writing a book about parents of such kids, right? Two things. Who are these kids, right? We want to understand the profile of the kind of kids who come to you, and also the parents.
So these children are usually who have heart defects, what we call. They have defects in the heart from birth.
Okay.
So it can be in the form of just a simple hole in the heart, what we call, or some children are like what they are called the blue babies, when they have some obstruction to the blood flow in the heart.
Okay.
So they have mixing of pure and impure blood in the heart, and then they have the impure blood circulating in the body. So their oxygen saturation is low, and that is why we call them the blue babies.
Right.
A very small percentage of these children don't require any treatment. The holes may close on their own.
Oh, okay.
But like one in 100 children do have heart problems, and a small percentage of them do have problems which require treatment very early in infancy.
Okay.
So it may be in the form of surgery or without surgery, like what we call the angiographic method. The surgery for the complex ones could be in one stage or in more than one stage, or sometimes even in 3 stages. And many of them will require a long-term follow-up because they have had a heart which has been operated. So it's not easy, like as a parent, you're a mother, I'm a mother too. We know, like, even if the child falls sick with a cough or a cold, we know how difficult it is for us. We can't concentrate on our work when the child is sick.
Absolutely.
But then when the child is undergoing a major heart operation, the heart itself invokes a lot of fear and anxiety and everything. And if the child is going to undergo a treatment for the heart, whether a surgery or any other procedure, it's going to be in the intensive care without the mother being able to be with the child to provide the care. So that kind of separation away from the mother, away from the parents, they go through it, and then they go back home, they continue to give the care, they continue to give the medications, they remember to come for yearly checkups, and there may be some surprise that time for which they may need some other procedure. So it's a long journey for the mother and the child and the whole family.
Right.
It's very important, but from what I've seen, I mean, of course, I've seen very wonderful fathers as well, but it's on the mother, to take the whole responsibility to just take this child through this whole journey. In fact, I would only call those fathers as the Tayumanavar fathers. They are very, I mean, of course, they are there. There are some of them, but mostly it is the mothers. So I have met some of these really incredible mothers, like some mothers who have had to operate on both their children.
Okay. Oh, okay.
So that is something which, imagine you just go through with the journey once and then you have to do it again with the other child. Wow. It is very difficult. These mothers are immensely strong, very strong at heart. And the other thing is, like, another mother whom I saw, like, she, the child underwent one surgery. Few years after that, he developed blood cancer.
Oh, okay.
So that's another whole set of different kind of intensive treatment with its own course and ups and downs and medications and long-term follow-up. And there's one mother whom I remember very well. Like, she was just a +2 graduate. She had 2 children. One child had a complex heart disease for which he had 3 surgeries. When she was just recovering from the 3 surgeries, her husband passed away in a road accident. Her second child, he developed diabetes, juvenile diabetes. With an emergency, he had to go to a hospital, and now he's still on insulin, daily insulin. So this mother with 2 children who are sick with chronic illness, meaning that they need long-term follow-up, long-term medications. This mother, she went ahead and did a graduation by correspondence. She wrote these government exams, and right now she's employed in a court as a court assistant.
Okay.
So when she came with her job order and her identity card to show me, I was immensely proud.
Wonderful, wonderful.
So there are so many such mothers who really kind of inspire us. I mean, I'm sure I definitely have become a better doctor, better parent in all these years, meeting all these kind of parents and patients.
When you spoke about being parents ourselves, right? So when my kid falls, or she has a small injury, or she has a small cut and blood oozes out, there's this panic that runs through. Is she in pain? Does she know what she's going through? Can she talk and all that? And here you are attending emergencies for neonates who are like just born or a few minutes and stuff like that. For which I think there has to be a lot of immense strength, because you are under the pump, is an emergency situation, there's a life or death situation, and you have to think calmly and take the right decisions, right? Even a small miss here and there can lead to adverse outcomes. I'm sure you developed that inner strength over a period of time. So I want to understand, from comparing yourself from the first time an emergency you attended to today, what has that journey as an individual been?
Such kind of occurrences are quite frequent in our profession. Certainly what I would say is, as a doctor, when your basic training and your ethics and everything you develop as when you're becoming a doctor during your undergraduation, I think that thing is sealed. You know exactly, I mean, you kind of develop the knowledge, and then you know how to act exactly, and you know how your knowledge will help in that situation,
right?
And your decision making, your thinking capacity, all that. So I think that basic foundation is very, very important.
Right.
Of course, nothing to match the experience. Because the first time, even though you have the knowledge, if you not have had the experience, it's really going to be the first time. For that, I'm sure there have been a lot of seniors who have, trained us in this process and inspired us in this journey. How we grow over time is, like, I usually amaze like how my own brain is active and thinks rightly in that moment. If I'm doing a night call, if I get a call at 2 a.m., I mean, I do take rest in the middle. If I get a call at 2 a.m. saying that the child is sick, somehow my antenna just opens up and thinks of all possibilities and thinks of all the steps to act at that time.
Okay.
And of course, when we work in such a specialty like this, it's all about teamwork.
Got it.
We do take the lead as a person in that situation, but then we do have a wonderful team of other colleagues, nurses, other paramedical staff. And in these days, to deliver such amount of intensive care where we can guarantee excellent outcomes, it more than the technology, it depends on the people who work there. I mean, I would say a big kudos to my nurses and other staff who are a huge part of this process. We have also learned over the years, there would have been bad experiences, but then we learn from it, and then we always, like how we learn in medical school, do no harm is the first principle. So we always strive to work towards that and try to achieve the best result.
Wonderful. When you're talking about teamwork, I also have this question that's coming up. When I think about kids who underwent major heart surgery at a very young age, right? And when you send them back home and they go to school, they try playing like normal kids, and is there any kind of awareness that you tell not just the parents, but I always think that should the school know that this kid has to be treated with care or handled with care, or certain symptoms or things that, if you see that the kid has experienced these kind of things, call me, or certain things like that. Is there two questions? One is there enough awareness at school and places where kids usually go to around available? Second thing is, how do you ensure you tell them that, please ask the teachers to call, or the school where you enroll to call, so that I give tell about what this kid might undergo and when you should be reached out. Is there something like some framework that exists right now?
Unfortunately, there is no structured framework. But then we are also seeing a lot of children like this with chronic illnesses who are going to get into the community, going to enter normal school, play with your children and my children.
Right.
But it is also not possible to, deprive them of the normal childhood. So we have to find a balance between their vulnerability and their capability. So that is where the teamwork between the parents, the healthcare provider, and the school comes into place. Even today, I had a patient who has undergone major surgery. The child is 4 years old. 3 schools refused admission for that child when they knew about the child's massive health record.
Okay.
It is understandable from their point of view, because suppose there was an event in the school would not be able to handle, then they would have to face the blame and other legalities. But I think it's a point where the teacher and the doctor come together along with the family. They understand the situation. The parents also are aware that the child is possible to have some emergency. We have a backup plan for that. I think that has to be developed on a case-based scenario. For each child, it may be different. But but when we're going to have more and more children like this, it will be certainly worthwhile to develop a structured system for that.
Right. And when you look at medical science and the development of that over the past, at least the last 2 decades, right? It's gone leaps and bounds. NICUs are not that rarity like it used to be before. As a person practicing medicine, and you see all of this around us, right? And we talk about Gen AI, I don't know how much it has penetrated into medical science. What do you feel? You feel is it too much of technology, or you think it's in the right proportion that it's allowing you to save more lives? How do you look at the growth?
The technology and the expertise, knowledge, everything has grown in leaps and bounds. It's again how much we use the technology to deliver appropriate care.
Right.
There is still a blame where the doctors kind of, order like too many investigations or do unnecessary tests or do unnecessary hospitalizations. We have like grown from a place where we were, actively treating a person to like people have started practicing what is called defensive medicine.
Right.
That is again with the evolution of many other things. But it is definitely wonderful that there are so many diseases which were not treatable or did not find a cure many years ago, when the ICUs could not provide the care. Preterm newborns could not have the care. All that has grown in huge amount. So Today in Chennai, a 26-weeker or a less than 1 kilo baby has a very good chance of survival.
Wonderful.
So that is wonderful for the parents when this day, in this day and age with so many women pursuing careers, for them to take a break for a childbirth and maternity and with the kind of issues, for them to plan their pregnancy, so much of medical support is actually important.
Right.
So I think it has only done good. Of course, we have to, function with caution.
Absolutely. Doctor, we have an activity right now. So I'm going to give you the journey with the Devi's book. And this is the page where all the 9 Devis descriptions are given. I want you to take a look and tell me which is the Devi that you relate to yourself as a doctor and as a person the most in the 9 of them.
First of all, many congratulations for bringing out such a wonderful book.
Thank you. Thanks.
I am very happy to have been one of the first recipients of the copy. And it has actually increased my knowledge about learning these things about Navratri and other stuff actually. Let me just spend a minute to go through it. And
while Doctor spends a minute there, I also want to quickly tell about a beautiful note. So Doctor and I caught up in our elevator when I was carrying the first proof of this book. And we just had a conversation and one thing led to the other, and we kind of had, she was going to a conference in Kolkata for Down syndrome children, right?
Yeah, that's right.
So, and we spoke to the organizers, we pulled a few strings to get a few sponsors, and we could send across 120 copies of the book for children who had Down syndrome, and that was a beautiful moment. The book was only 2 days old, and to have that kind of a journey early on, it was a blessing in disguise, and she facilitated all of that. So big thanks to her. I would like to take this moment here.
It was a real wonderful experience. So yeah, this is a very interesting question, I should say. If I go through this, I think at different phases of life we all have to don different roles like this. So sometimes in the same day, morning and afternoon and evening may actually vary when you have to take up different
avatars
roles,
on the same,
different avatars actually. And
you find a combination of a few of them.
Exactly. So I would relate to this Chandrakanta and Katyayani.
Okay.
So I feel the thing is very important. This courage and strength is what drives us through the various phases of our life.
Absolutely.
Whether it is home or career or dealing with the community or whatever, it is very important. And of course, when I look at these 2 avatars, I feel like, I would how much ever wish to be, reach that wisdom and enlightenment. I hope I will reach there someday, but I'm sure it's a long way to go, but definitely inspiring.
Thank you. Thanks a lot. With that, I will give that as a token of our love and gratitude for being here and talking to our audience. So this is from Aarla.
Thank you so much.
Thank
it
you.
was wonderful. Very nice initiative, actually.
Thank you. Thanks for your time today, Doctor, and happy Navratri to you and everyone in the family.
To you as well. Thank you very much.
Thank you.
This is wonderful. Thank you so much.